Welcome to the Origin Wellness Podcast, where we go beyond surface level conversations to get to the heart of what truly impacts our communities. We're not here to tiptoe around tough topic. We're on the offense when it comes to access to information. Whether we are unpacking the reality of men reproductive health, exploring how cultural traditions shape mental wellness, or tackling the conversation that are too often ignored, silenced, or labeled taboo, nothing is off the table. Each episode is an invitation to think deeper, live healthier, and advocate louder for yourself and your communities. We're here to inform, disrupt, and to heal together. This is the Origin Wellness Podcast. Let's talk. Good morning, good afternoon, good evening, wherever you are in the world. And welcome to another episode of Origin Wellness Podcast, where we don't let any stone be unturned and we tackle every topic that affects the underserved communities. Today, we are going to be talking about a subject that we believe is not being talked about enough. It's men's reproductive health. And we have with us today the honor of having Dr. Juan de Los Santos to give us a very detailed presentation about prostate specific antigen and myth and reality. So we are going to peel the layers and see what's what about all of this. So without further ado, Dr. De Los Santos, go ahead and introduce yourself and let the people know who you are.
Thank you, Natasha, for having me today. My name, as you mentioned, Juan de Los Santos. I'm Dr. de Los Santos. I graduated from med school from the State University in Dominican Republic. Moved to Puerto Rico, where I was working in the medical field um, in the underserved community for the community care as a primary care general practitioner and doing work in the emergency room of different institutions there. I moved to the state last almost 15 years, and I've been working on correctional medicine, um, different sectors, including urgent care, and later as an outpatient clinic in the underserved Medicaid and also Medicare patient also. And finally, the last year in a psychiatric community hospital, uh, uh, working in the delivering medical attention for as a primary care in that institution.
All right, all right. So, see, people, you are in good hands. We are going to begin um, talking about the male reproductive system. And today, for the men's health, the conversation that we're going to have, we are going to talk about the prostate. And in order for us to talk about the prostate, you guys need to get a little imagery and see what the anatomy looks like. So, go ahead, Dr. De Los Santos.
Well, there, we have an image of the male reproductive system. I choose this one to present the importance of um, the anatomy of the prostate, where it's located, um, for people to understand that. Uh,
So that gives us a good idea, a good image of where the prostate is.
yeah, and as I mentioned, it's a gland that will be located, as you see in this slide, below the bladder. Okay, this is the prostate in front of the rectum and around the urethra.
Okay.
This is a very important anatomy view so people can understand that why we will talk about digital rectal exam, okay? Because by introducing a digit on the rectum, we can palpate through the rectum, we can have an idea of what's going on in the prostate by that
Mm-hmm.
palpation. And then how the anatomy will be related to urinary symptoms because it's surrounding the urethra. That is
Mm-hmm.
the, the conduit that the bladder utilizes to expel the urine from the bladder. Okay, so
Mm-hmm.
prostate in reality is a small, it's described as a walnut size of 3 centimeter gland of the male reproductive system. Consider normal around 30 ml. The doctor will talk about what's your size. We mentioned about where it's located. And the prostate function is to produce a prostatic fluid. That prostatic fluid will transport sperm during the ejaculation and facilitate in that way the movement of the spermatozoid during the fertilization of the ova. The enzyme that is produced is called prostatic or prostate specific antigen or PSA, we're going to mention from now on.
Mm-hmm. And we talked about the PSA, but I know that there's a lot of the guys out there always want to know like what is the normal range for the PSA?
Uh, I would like to divide this question uh, by explaining. We already explained about how the PSA is a protein produced during that prostate. Um, it can be produced by normal cells in the prostate. It can be produced by malignant cells in the prostate. And what's the importance of this? Because a high PSA level could be from different things that we're going to see later on. Uh, the PSA is being also not only secreted during as part of the semen to liquefy the movement of sperm, it also being produced because it can leak to the blood. Okay,
Mm-hmm.
by leaking into the blood, we can measure it in the PSA test and we can monitor prostate activity. We can monitor prostate activity not only by the PSA, but also by the digital rectal scan that we mentioned, by imaging studies, and by a prostate biopsy if needed. In reality, PSA was approved by FDA in 1986 to monitor the progression of prostate cancer in men that were already diagnosed with the disease. By 1994, the FDA then approved the use of the PSA along with the digital rectal exam for a screening as a screening tool for prostate cancer. Okay,
Mm-hmm.
so it's important to differentiate that a PSA testing in blood will measure a total PSA and will measure also a form of PSA that is called the free PSA. There's the most detectable one is the total PSA between a range of 65 to 90%. And also that PSA total is one that is attached to proteins in the serum. There's another one that is free from attachment, but it doesn't quantify 10 to 35%. If you take a look at those numbers, you're going to see that there's a lot of intervariability between patients. Each patient is going to be different between the size of the prostate, between this variability, okay, age. We're going to see later how that happened. And then it's important to also address that we measure total and free because the free one is more present in lower number in men with prostate cancer, but also when there's high number of the free PSA, it can be related to a condition that we call benign prostatic hypertrophy, which is an increase inside of the prostate of benign from a benign condition that is not cancer related. That's very
Mm-hmm.
important. Okay.
Okay.
Uh,
So, what result should men expect to be normal range, if that exists, a normal range?
Yeah, that's very important because not always we have a blood test that we really don't talk about normal numbers because the levels the of what is a normal remains like a debate in the medical field. I
Mm-hmm.
prefer that people understand that we're going to talk about what is an elevated versus a non-elevated test, and
Mm-hmm.
that's again related to patient viability. Okay, up to 2.5 nanogram per ml is considered safe. Between 2.5 and 4 nanogram per ml, it's safe in most men, but then the doctor need to look over risk factors that we're going to talk about risk factors later on.
Mm-hmm.
Between 4 and 10 is a suspicious test, okay? But that means that, again, variability. Higher number can either indicates prostate cancer or not, and low numbers also can indicate prostate cancer or not. And you're gonna see numbers later on that are also related. We're gonna explain that. A
Okay.
current recommendation, we're going to put PSA test on a 50 years old male. What is recommended is that everybody should have a test done around 50 years old, unless you don't have risk factors that will make it important for you to do that testing earlier. If a patient has around 50 years old and his PSA level between 1 and 1.7 nanogram per ml, uh, uh, it should be around that number at that age. If you have more than that, then the doctor will see your risk factors for further evaluation.
Okay.
The other important thing is that if you have, uh, let's say, a PSA over 4 that normally is thinking that could be like a normal number, it's important for you to discuss with your doctor uh, because probably you will need further testing for an elevated test. Again, important to check your free PSA along with the total PSA. Um, Always looking for what the numbers will be, which could be related, yes or no, to cancer patient.
Mm-hmm.
PSA, um, as I mentioned before, initially there was thought to be like up to 4, a number that will be like a safe one. But later on, studies that were done, especially on prostate cancer patients, determined and they were looking at, they find out that prostate cancer cells has like a doubling time values for a period of time. What that means is that normally a prostate cancer cell can double the PSA number in a 2 year period. Okay.
Mm-hmm.
If we then find a patient that will have an increase in PSA, let's say 0.75 nanogram per ml in a 1 year period, that will be like a sign of a warning sign indicator
Mm,
of prostate
okay.
cancer in that type of patient. The other thing, very important with prostate specific antigen with PSA, is that the older we get, the increase in size of prostate gland. Okay,
Mm-hmm.
so the bigger the prostate, the higher the number of the PSA. So when we find out that with men aging and getting older and getting a bigger prostate, there will be a normal increase in that PSA, and then an age-related increase in PSA was developed. What that means is that the level for PSA, where we have an age-specific reference ranges. for PSA in healthy individual. That means
Mm-hmm.
that people are getting older, are getting bigger prostate, and they're getting bigger PSA number that are totally normal because they are healthy individual and they're not uh, they don't have any condition.
Okay.
Uh, with that range, we started with 50 years old. We said that for under every patient under 50 years old, we start having a PSA up to 2.5 nanogram per ml. If his patient has between 50 and 59 years old, then the PSA for a normal PSA was told that will be up to 3.5 nanogram per ml. The range between 60 and 69 got a normal PSA up to 4.5 nanogram per ml. And patient 70 years and older, we can say that a normal PSA could be a 6.5 nanogram per ml, which is something important because at least by a specific age, we can have what could be like a normal PSA by range of
Mm-hmm.
age that was not related to the previous discussion of having 2.5 or 4 up to 4 as a normal on every patient.
Okay. So you mentioned that the patient with a PSA in the safe zone should take into account risk factors. Um, this is something that we are going to talk about in the second part. Um, this is going to wrap up the first part so that people can get little bite size of information and not be too overwhelmed.